lot of confusion between what is mHealth, eHealth. The answer is, it's healthcare, just another service delivery channel. Everything from healthcare, medical will migrate and should migrate to, a ubiquitous, whether it's data, real-time data capture device like cell phones. But I think what's, some of the problems is there's just too much hype, and there are too many players coming into the market who are a little naive in perhaps their understanding of what is, or what are the challenges of dealing with healthcare.
It's going to be ubiquitous to the point of disappearance, and that everyone's got a mobile phone and everyone's going to have this, to the point where they won't call it mHealth, it'll just be health. Right? It's just assumed that you will have something mobile, and it's assumed that this is my personal medical device.
Yes, mHealth has a huge potential, and looking at the mobile penetration and shrinking fixed mobile phones, I think that it has a long way to go, but it just requires a lot of hard work. I mean, things will not take up like that. It's healthcare, it's got to be complicated.
I think it will be part of a larger e-health strategy, which eventually majority of the countries worldwide will adopt. And I think mHealth will be the first part where really the case studies or lessons learned or the failures from the emerging markets will be introduced in the developing markets. Could be.
The future which I see is that yes, we will be able to do video conferencing. I see that my patients will be interacting with their physicians through video conferencing. They will have their electronic health records on their mobiles as well as on a web portal. They will have a collaborative, empowered way of getting healthcare. Mobiles will actually help the integration of all the stakeholders which the computers have not been able to do. The mobile will actually connect the physician, the pharmacist, the lab technician, the health manager, the regulator, and the patient.
This gadget is the most intimate gadget, rich or poor, and it's a means of getting to the patient, to the consumer, to the customer. And whether regulation is going to be an obstacle, or medical practitioners are going to be an obstacle, or business models, at the end of the day, this is going to drive the innovation. And I don't think we can stop it at this point. It's just going through little peaks and troughs. And I actually believe that the developing world will actually bring together the most innovative models that will then be adopted by the West. I think the West just has not been exposed to some of the needs for such a long time, and it's got this whole infrastructure that it has to support that it cannot actually step out of the box. And that's what you need. You need a clean slate to start, and we have a clean slate, so I'm quite excited.
I think that mHealth is it's a fantastic opportunity to explore the establishment of a unified platform for countries to collect information, store information, share information, and possibly process information for decision making. We see mHealth as a means to that end, but not the end unto itself.
Well, what I think is really important that mHealth in Western economies is really for patient monitoring and remote sensing of vital functions of your body. I think that's the future where we can have an added value in healthcare system.
Private health systems, private businesses that take enough interest to finally decide that they're going to do something about the unsustainable model that we currently have, and ultimately consumers themselves start to take hold of this. I think that's when we're going to see a tipping point, and we'll see mHealth become a driver in the way that healthcare engagement is transformed.